I want to say thank you for coming out this afternoon and covering our press conference. Thank you to all of our friends and allies and our picketers who are out here keeping our picket line strong. So one of the things that I just want to remind everybody is although we are on strike at Mercy Hospital of Buffalo, we are actually bargaining 6 contracts right now. We're bargaining for the RNs at Mercy, Kenmore Mercy, and St. Joseph Hospital. And we are bargaining for the service employees at St. Joe's, the technical employees at Kenmore, and a full service technical clerical unit at Mercy. So we're bargaining 6 contracts covering 2,400 members at 3 hospitals. Our members at St. Joe's and Kenmore are not on strike, but they are supporting our members at Mercy in every possible way. And I want to say thank you to everybody who's here from Kenmore and St. Joe's. So we also have a number of allies, community organizations, our friends and the elected officials, and number one, I have to say thank you to all of our labor unions, the Area Labor Federation. I see NISA, Buffalo Teachers Federation was here, UAW, the Steelworkers, the Teamsters, you name it, and they've been out here. And our CWA locals from across Buffalo, from across New York State, from across the country are sending their best wishes and donations in support of our strikers. So thank you. So the update for today, and literally right before we started this press conference, the mediator and I finally received a communication from Catholic Health. And basically what they're saying is, I know you reached out to me early this morning about resuming negotiations, and before negotiations ended, they said that they gave us a full written proposal and they're not coming back to the bargaining table until they get a full written proposal back from CWA. Now, let me tell you what happened. Bargaining we had let them know that we were going on strike. Our bargaining committee was gone, and the attorney that works for Catholic Health came in with a stack of crisscross papers, plopped them on the table, and said, I don't know if you want this now or not, but this is what we were going to give you. So, and it did not represent a complete proposal. Having said that, and this is typical of what our bargaining has been with Catholic Health, having said that, our committee is ready, willing, and able to get back to the bargaining table, to look at what they plopped down there after we left, and to get something to them in writing that represents what we need to get this strike settled. Our members have been very clear. Everybody I spoke to today said we're out here because we have to be, but we'd much rather be inside caring for our patients. So let's get this done. So we will work tomorrow to get a full understanding of what's in the papers they left over at the bargaining gateway where we're bargaining. We'll look at getting something back together, and we will make sure that the mediator knows that we are going to respond, even though what they plopped on the table was not a proposal that they presented to the committee. So I want to say that. CWA, our members, every month when they pay their dues, pays a small percentage of their dues into our member relief fund. CWA has a $440 million member relief fund, and we have $1 million SIF that we wrote, a grant that we wrote, just to make sure that we can sustain this strike. So we'll be out here as long as it takes. We'll be out here as long as it takes to get an agreement that we know our members will be proud of. But again, if we have to get back to the bargaining table tonight or tomorrow and start looking at what's there and getting something ready for them, we'll do that.
Amen.
So,
Yes, we will. Yes, we will.
They'll be there.
Yes, we will.
We have a number of speakers here today, and we also had a patient incident on the picket line earlier. I'm not going to talk about it because I wasn't here. We'll get through a few of our speakers, and then we're going to have a couple witnesses to the event talk about what happened. Our first speaker is Jackie Atipio, who's an RN at Mercy and president of local CWA Local 1133.
Thank you, everybody, for coming. Thank you, everybody who supports us. I would just like to speak on some of the conditions in the hospital and remind everybody why we're here is not because we chose the strike. The strike is completely on Catholic Health.
Amen.
And in one area I'd like to discuss is wages and this wonderful package that they gave us. And in the one package, it brought pay for certain people all the way up to $14 an hour. That was their huge raise, up to $14 an hour, and they won't even hit $15 an hour for 2 years. And these are people that are the front line of our protection. These are people that come in, and when you come in, you don't want to touch anything infectious, you don't want anything dirty. These are the people that make sure that we're safe. They make sure that nurses are safe, patients are safe. They know how to clean every kind of infectious disease there is, and they jump in front of it, and they make sure everything is done. And to make something so low, so by the time minimum wage hits $15, the state has to bump you up. That's absolutely terrible and disrespectful, I think, to the top line front people there. I'd also like to discuss that when you think about something like that, there's been a report that the top people at Catholic Health, there's 11 of them that total $7 million.
Criminal.
So, yeah.
Criminal.
And it is, especially when you take it apart. If it's got a place that's running great and people that are doing their jobs are getting paid well, and you had washcloths to wash a patient with, and a computer that actually works so you can send information, and oxygen, pulse oximeters to make sure that your patient with COVID is breathing okay, and EKG leads because patients, their heart monitors go off, and you have to know exactly what that lead says in order to treat it. If they had stuff like that, that would be one thing, but we don't. We don't have any of that, and we have 11 people making up to $7 million. We have friends and family in there. I've seen some of their family on some of the reports making money while other people, while we're lost on the equipment and other people are getting paid so low. So I just want to remind everybody that we're here because of your safety, and if somebody claims wages, I want to remind you that the people get to go all the way up to $14 an hour, some of the people with that rate. So thank you for everyone.
Hospital. I have worked with Catholic Health for 5 years, but have been a registered nurse for 11 years. Even before the pandemic was declared, years earlier, staffing was suffering. For years now, patients have not gotten the care they deserve because staff isn't readily available to help them. 2 years ago, I worked on a medical surgical floor taking care of no more than 6 patients. This is still a heavy assignment, but could be managed in a way. Now, nurses are assigned 10 or more patients on a daily basis. Every department is running shorthanded, but it's still required to give the same amount of care as a fully staffed hospital. This has been detrimental to patient outcomes. Overnight, it's not uncommon for 1 or 2 staff to clean the entire hospital. Cleanliness during a pandemic should be the gold standard. All we want is safe staffing, equipment and supplies to do our jobs, a clean hospital, and respect from management. Please stand with us. I'm a healthcare hero, and I, like everyone else, is not okay.
We have so many supporters here with us today, and one of them is our very own Erie County Executive Mark Polenkars, who we'd like to invite up to
Good afternoon, and I am proud to be with you today. Before I forget, remember last year in the height of COVID when things were very bad, my father had an illness, not COVID, but he had to be hospitalized, and he came here to Mercy. He got tremendous care from the people that worked here in Mercy. And on behalf of my family, I want to say a big thank you to each and every one of you. Now, my mother used to work here as a cardiac care nurse. She had a health issue that took her out of work for a while. And she didn't get treated well by Catholic Health in the end, because when she was ready to come back, her job was gone. And that was over 20 years ago. And here we are today, and there's still issues in Catholic Health in this hospital regarding staffing. So I've talked to Mark Sullivan. I've talked to him over the last few weeks in the hopes of averting a strike, and as you all know, strike was not averted. So I'm proud to stand with you as we have myself, my family, and the administration of Erie County to say we stand with you and we need you back working. Unfortunately, the hospitalization rates right now in Erie County are some of the highest per cap capacity they have ever been. There are more people in hospitals in Erie County as a percentage of beds right now than they were even in the worst days of COVID. So I say to Catholic Health, get this strike over with by giving them a fair contract. To all of our healthcare heroes, thank you for everything you've done as long as you've been a member of healthcare. Maybe the public finally has realized it during COVID, but thank you on behalf of myself and my family for all you've done for us, and thank you for the community. And I truly hope this is a short strike, and that in the end, when you walk back in there, you can walk in with your heads held high, knowing that you made a difference, and the work environment will be better here from now on.
So we have a woman here to speak to us today who wears 2 hats. First, she is the leader of the Working Family Party of Western New York, and is also the LP coordinator for NYSA in Western New York, Louisa Pacheco.
Hi everybody, it's my honor to be here among you today. The healthcare workers for my whole life have been in my life and saved my life many, many times. It's not just the nurses, but it's the entire team of the healthcare community. We're talking about the food service providers who make sure the people who are visiting their families in the hospitals are there to take care of those families while their loved one gets better. The staff that are janitors and cleaners and make sure that everything is pristine, so our nurses and those teams of medical experts can come in and take care of us and our bodies while our family members wait for us, is essential. They need a raise. It's not enough. And I stand here as not just Working Families Party and New York Catholic name in it is saying that the people that do this work are not divine human beings. They have carried us through the coronavirus. They were here on the front lines. They were our heroes. Then they are our heroes now. And they deserve. Let them get back to the work they do. Let them get back to their calling and end this strike.
Thank you. Sí se puede. Sí se puede. Se puede.
I'd now like to introduce to you Heather Lawrence. Heather is on our bargaining committee, and she is also an RN at St. Joseph Hospital.
Okay, Nora.
Hello. My name is Heather, as Debbie had said. I'm an operating room nurse at St. Joe's Hospital, which is also managed by Catholic Health. While my brothers and sisters here at Mercy are on strike, we're not able to join them on strike, but we are here supporting them with my coworkers in solidarity and support. St. Joe's battled COVID. We were the only COVID hospital in all of the area for almost 18 months. We walked into that hospital not knowing what we were walking into and not knowing what we could potentially be bringing home to our families. We worked tirelessly to take care of our community, only for them to turn around and shut us down. They shut down all of our med-surg floors, our ICU, and forced many of us on layoff and to go into other areas of work. My hope is that Catholic Health will work with CWA to address our issues and bring this strike to a close quickly so that all of us across Catholic Health can get the resources we need to do our jobs with dignity. Thank you.
Our next speaker is a friend of ours from the days he was in the Erie County Legislature, and I am proud to introduce to you New York State Assembly Member Pat Burr.
Thank you, Debbie, and welcome to South Buffalo, everybody. This is a community that understands the value of labor. We understand the value of nurses. We understand the value of firefighters, of the movement, of our police who are protecting us and keeping our lines safe. Thank you to our law enforcement officers. You know, long before I was an elected official, I actually worked in this hospital. So I knew I wanted to do a career in service. And I thought it was going to be nursing, but my mother wisely said, you know, before you go all in, why don't you work there? So I was a nurse's aide for about 6 months. And honestly, like, I feel a kinship to all of you because I understand what it's like to be on a floor and see all of those lights lit up. And you're all alone, right? And it's not just that you're tired, it's a physically demanding job, but you know you can't treat the people that you're supposed to be treating the way they need you. So you get into a room and you have someone who's desperate, who's been waiting for you, and you know you have to run to all the next rooms. And it's not right and it's not fair. And that's why we're here demanding a fair contract. That's why we're here striking and fighting. We're showing our power as a unified workforce. So thank you all for being here. We're with you. Your elected people are with you. And South Buffalo is definitely with you. Thank you.
This is my beautiful granddaughter, May. When my kids were her age, this is what they did with me. This is how they grew up. So, next generation, right, May? Woo! So, I want to introduce to you two of our members that work in EVS. I want to talk a little bit about the stress that they face in that department, and I'd like to introduce Kim and Diane.
Hello everybody, CWA, union workers. My name is Kimberly Hayward.
Hi, my name is Diane Peach.
My job at Mercy Hospital is the EVS department. I've been in the EVS department over 3 years doing work that I love to do to keep the patients safe and the staff of the nurses are safe. I hope that this one had to come to this point, but yesterday the union had to make a difficult decision to go on strike due to months after begging Catholic Health to help with staffing crisis. This was the only decision we had to make, was to go on strike. We're striking today to stand up for the community and also for the patients that's in Mercy Hospital of Buffalo. The Catholic health system has failed to establish safe staffing ratios that will keep our patients and our staff safe. We need a contract so that it can help us deliver the highest standard of care for our patients and also for the nursing staff that's within the hospital.
I work in EBS, and I do a lot of ORs where there's blood.
Labor, love it.
Stuff that I have to clean up before the next patient to come in too. And with that said, you know, I've been doing this for 3.5 years here, and I don't even make $15 an hour. We went on strike because we need more money. You know what I'm saying? My department can't keep nobody. Everybody is run off to different departments. It's just not fair. It's not fair and it's not equal. We are doing everything that we can to try to save lives and support families by Catholic Health as made impossible for our jobs to be done. They have failed to establish safe staffing ratios with this. And I can remember being in a patient's room that I was just going in just to mop the floor, and she had heart surgery in her, and I guess it wasn't set up, but her blood started popping up, and blood was squirting everywhere. And I had to clean that up. I had to get the nurse. I had to be there, you know what I'm saying, and watch this go on, you know. And when I walked out to that room, all I could do was cry, you know, because I just wanted to make sure she was all right. You know, it's just stuff like that, you know, and we just hope we get a good contract, you know what I'm saying? Yeah. So all of us continue to do our job at the best possible.
To do this, but EVS are environmental services, folks. Healthcare delivery is a team event. There is not one of us here that can do it by ourselves. It takes everybody to do it. And there's nobody that should be doing the work they do and not be making a living wage. That is a crime. We also have with us another one of our friends from the New York State Assembly member, John Rivera. John, come on.
Well, thank you everybody for allowing us to be here with you. There's an old expression that you hear in Spanish homes, and I heard it a lot growing up, and it was, dígame quién andas y te diré quién eres. What it means is, tell me who you walk with, and I'll tell you who you are. Oh. And I'm proud to walk with you. I'm proud to be part of this with you. It is an honor for us to stand here, knowing that this is just one corner in South Buffalo, and yes, this is just one hospital, and yes, this is just one contract negotiation, but it's more than that. It's about respect for employees. It is about fairness. It is about transparency in hospital management. It's about a million other things that we're fighting for in Albany, in Buffalo, and everywhere we have to go. So let this fight continue, but because we know we're doing it for the right reason. Believing that every day you've worked in this place, you've deserved better. Believing that every day, every minute that you've devoted to your patients, you've deserved better. Oh, that's awesome. And we're here fighting for what's better and what's right. So thank you very much.
So we had a sad incident on the picket line around the back of the hospital today. And we have two people that were back there when it happened David and Madison, and they're going to talk a little bit about that incident right now. David, Madison, David. I see him. David and Madison, are you ready? Come on up here. Yes. Yeah, no problem. I don't know. Come on up this way, David. Thank you. Talk about what happened and what you saw. Step right up to the microphone. Step right up to the microphone.
Y'all ready?
Yeah.
I happened to be picketing behind the hospital near the emergency entrance, and I looked over and a young lady was walking out of the hospital, and she joined the picket line. I asked her if she needed some help, and she said she was a little tired, so she grabbed my arm and we walked for a little bit until some hospital personnel came out. They took her. Wow.
Where did she come from? What part of the hospital did she come from?
Do you know where she came from?
We was a doctor's lot next to the ER.
Yeah, the ER.
Floor.
And she was wearing yellow fall socks?
Yes.
Oh, she's definitely a patient. Oh, yes.
And a robe.
Yeah, definitely a patient. Take care. Thanks.
Thank you. There's video of this, and we don't want to share it because we don't want to violate her privacy in any way. But it was an elderly woman who was sad because she wasn't getting the care she needed inside the hospital. So she literally walked out with her hospital garb still on, took David's arm because she was tired and held on to him until somebody from the hospital came out to get her back in. So, and that's why we tried so hard to make the point yesterday, and it's worth making again today. You can't bring in strike breakers and expect, you can't bring in people who don't know the hospital, who don't know our patients, and expect that they can take care of our patients. These workers should be inside caring for the sick people in this community. And this is exactly what we were afraid of, that there would be adverse care being given inside the hospital and that the patients in our community were going to suffer. So again, it is time, and we call on Catholic Health to come back to the bargaining table, get this done, and get the people who should be delivering the care back inside.
I'm a nurse at South Buffalo Mercy Hospital, and I've been here over 15 years. And it saddened me to hear that story, because these are my patients, and I want to take care of them. And I am also on the bargaining committee, and I've been bargaining with Catholic Health nonstop. Shame on you. Shame on you. Let us get back to our patients. Let us get back to our patients and give us a contract. I'm begging you. I'm ready to go back to the bargaining table, and I am begging you, be fair and give us a contract so we can put these people back to work.
We have another speaker here. This is Vanessa Quinn, who's an RN in the emergency room at Kenmore Mercy Hospital and on our bargaining committee.
And I'm also the e-board member for Local 1133. And Kimberly Mercy is 100% behind the strike and behind our workers. We've been on the line yesterday and today. They're coming in every day. We organize them as if we were the ones to go on strike. One of the questions that was asked over the bargaining table to our money person was, how can you pay $250,000 deposit to Huffmasters and then wire them $5 million to get these people in? Plus they spent about $10 million on agencies in the last 7 months and not put it in our contract. We don't understand that math. Well, I don't know about anybody. I know. And he really got insulted. His answer was, I don't want to go 10 for 10. That was his answer. So we're all ready to go back. Everybody on the bargaining team. Come on, whoever's here. Come on, Maria.
Come on, bargaining team.
Yeah. Longer and longer and longer. So the last day we worked, we got there about 3:30 in the morning. You can't think like that. If that's their strategy, they're doing it wrong. You know, because that you can't think and we're not going to do it and make a mistake. So Kimberly's behind you and they are with you and good luck. Thank you. Thank you.
I just want to let you know that we have a surprise speaker. Her name is Abby, and her mom is a nurse in the ER. And this has had a significant effect on her family, and she wants to talk about it for a couple minutes.
Every day with like mask lines on her face, just crying. And now she is understaffed, underpaid, and overworked. And I just wondered why.
Amen. Good question.
It's got to be a proud mama right there, because it looks like we got our next generation Anybody have any questions? Anything that you want to know that we may not have touched upon?
The Lieutenant Governor was in town yesterday. He told us that they have boots on the ground, the Department of Health. The patient incident, will that be reported and could that potentially impact the services Mercy Hospital can continue to provide during this strike?
So that's a really good question. The Department of Health is monitoring everything that goes on in the hospital. Anytime a patient leaves what our healthcare workers call against medical advice, it is a reportable incident, and so I'm sure that they know it happened and will be assessing and making decisions about the level of care and what amount of care can be continued to be delivered.
County Executive, can the Erie County Department of Health take any action regarding that?
When it comes to the regulation of hospitals, it's the New York State Department of Health. We have nurses, we have staff, but they are not trained for acute care services like you see here at the hospital. And when it comes to actual review of the situation, the Erie County Department of Health does not have the authority to do it. It actually is the New York State Department of Health.
Thank you. Yes, no problem. Anybody have any other questions? Anything that we may not have touched upon?
You mentioned that $1 million in the relief fund that's going to the strikers at the moment. What's going to happen if that money runs out before the strike is over?
So the $1 million that we have in the grant is just to help sustain the strike. We have a member relief fund that members, through their dues money, support. So they are thinking ahead, just in case there's a strike, I'm going to be able to take care of myself. That fund has $440 million in it. So these folks actually are going to be taking care of themselves through their dues contribution, and we are not concerned at all that we are going to run out of money in support of the strike or our strikers.
All right.
Woo! Any other questions? Anybody have anything else?
Governor Hochul to miss the line?
I am expecting, well, let me put it this way. We are in constant communication with the governor's office. We are expecting soon that our Vice President of District 1, Dennis Traynor, will be here. We would welcome the governor to our picket line at any time. Woo! Woo! Anything else? Anybody have any other questions? Oh, here's one.
What do you think about India Walton?
We are not here to talk about the mayor's race. You couldn't help yourself, I understand that. All right, anybody else have anything? All right, thank you very much.
Fair contract now! 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 Oh, I'm sorry. Sorry. Fair contract now! Fair contract now! Fair contract now! Fair contract now! No, I know. I saw it. I know. Fair contract now! 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 Good job, everyone!
Thank you for doing that for Mom. I'm so proud of you for doing that.
Absolutely. Thank you so much for everybody.
I can't take the sunglasses.
I know, right? It's sad.
Because you make them wait 2 minutes each van. So you time it. For fire rating.
No, not my guy.
Oh,